Bismillahirrahmanirrahim. I'm Dr. Nizamuddin Uthmani, working as assistant professor, medical specialist, and pharmacologist, Khyber Medical College, Peshawar. I welcome to all of you to my YouTube channel. Today we are going to discuss another antibiotic, and that is the cycloserine. Though cycloserine is not routinely used as an antibiotic, we usually and specifically use these drugs for the treatment of MDR tuberculosis and for the XDR tuberculosis. What are the learning objectives for today? I'd like to describe the cycloserine, describe their clinical spectrum, clinical uses, adverse effect, and of course its mechanism of action and mechanism of resistance. Why we are discussing cycloserine over here? Because it's a cell wall inhibitor, and you know, we have started the series from the cell wall inhibitor, from the penicillin, cephalosporin, and the vancomycin, the phosphomycin, and we are also discussing the cycloserine in this group as well. So cycloserine, it's a very good antibiotic, but it is not routinely used for the treatment of common disease. It is usually used specifically for the treatment of resistant tuberculosis. Cycloserine is basically, it's derived from streptomyces. It inhibits the incorporation of D-alanine into peptidoglycan. So thus it inhibits two enzymes. One is called the alanine racemase, and the other one is the D-alanine ligase. These two enzymes, they basically block the building of that peptidoglycan. While peptidoglycans, the building block of the peptidoglycan is these D-alanine and D-alanine. They bind to each other, they make lengthy layers one by one, and so it's making the peptidoglycan stronger. So by blocking these two enzymes, one is the alanine racemase and the other one is the D-alanine ligase, it inhibits the mycobacterial cell wall, and thus it kills the microorganism. It kills especially the mycobacteria. And because of this mechanism, it's killed the microorganism. It has got some neurotoxicity as well. If it is used in the tuberculosis, especially in that one which is resistant to the first line drugs, it can cause severe neurotoxicity. And the reason is that we usually give these drugs for a very longer period of time in case of resistant tuberculosis. So usually, routinely, we don't use this drug as an antibiotic because it has got severe neurotoxicity adverse effect, and that's why we don't routinely use. But in MDR tuberculosis or XDR tuberculosis, unluckily you don't have other options, or you have very limited options, so you will have to add this drug into the cocktail of therapy for the treatment of resistant tuberculosis. Some of the adverse effects of this drug are the confusion, dizziness, headache, somnolence, seizure, and psychosis. All are the neurotoxicity type of adverse effect. So we don't use this drug routinely for the treatment of other infection. We just specifically use this for the treatment of resistant tuberculosis. So to summarize my lecture, cycloserine is an antibiotic which is a cell wall inhibitor. It's blocked two enzymes. One is the alanine racemase, and the other one is the D-alanine ligase. These two enzymes, they basically block the synthesis of the cell wall and strengthening of the cell wall, and by blocking that synthesis and strengthening of the cell wall, it kills the microorganism. We don't routinely use these drugs for the treatment of other infection because it has got a severe neurotoxicity type of adverse effect. That's why we don't routinely use this drug, and we use it specifically for the treatment of mycobacterial tuberculosis, which is resistant to the first-line anti-tuberculous drug. Thank you very much. God bless you. The detail of this drug is given in the description, so you can read from the description as well.